It's really a great pleasure to present to you where we are standing in trying to launch this Center for Research on Rare Childhood Diseases in Luxembourg. I think now it has been repeated a lot of times. These diseases remain underdiagnosed or with a long delay of diagnosis. I can say from a research point of view, and Fernand Pauli also said it from a medical point of view, they are understudied. There are thousands of rare diseases, but comparative to other disorders or diseases, there are much less research studies or research articles in the scientific literature to describe those diseases. And I think it's a very a big part of the explanation why they are also so undertreated. So indeed, 95% of rare diseases do not yet have an efficient or specific treatment. And coming back to a striking picture that Fernand Pauli showed with the phenylketonuria, so it is because we know very precisely what is going on genetically, enzymatically, chemically with in that disease, that by doing a very simple modification in the nutrition of that child, that we can prevent even the development of the symptoms. But this understanding, to get it requires research and a lot of efforts. So the poor understanding, the long delay still for diagnosing, the lack of treatments, and also the severity and chronic nature for a lot of these rare diseases makes that they represent a major healthcare challenge of our time still. And despite the big complexity and diversity of these diseases, there are some common properties that you could put forward. So it was already said, 80% approximately are of genetic origin and even monogenetic origin, which actually from a genetic point of view with the technologies that we have now can make it relatively straightforward to understand at least the genetic cause, to find it out. About 70% of these diseases start in childhood, and more than 80% of the affected children have neurological symptoms, which I put here these numbers because it explains how we shaped the concept of our research center, which we will present. So what about the rare diseases in Luxembourg? We have heard a lot about it already now, but in terms of research, yes, my lab is doing some research on that. There are some other labs, but we do not have a center that is in a more unified and integrated way doing research on rare diseases. It was said we do not have a rare disease registry, which is definitely needed and would help us also to shape further this research center. Will help to do it in the future. We have talked about the ERNs. I don't know if it's, I mean, it's a great thing that we have the coordination hub. I'm aware that we are also full member in one of the 24 ERNs, the endo one. Maybe it could be, efforts could be done to become full member in others. We do not have in the country a university hospital. I'm not saying this to say that we need one, but this is a setting in which tackling these rare complex diseases is facilitated. So we have to deal with that we do not have such an integrated structure here, where researchers and clinicians are closer together. However, we have, as you have seen already, highly committed stakeholders with close interactions going from the healthcare providers, patients, researchers, institutions, patient organizations, and government bodies. We had this first Plan National Maladies Rares that show this high commitment and with already results in hand. Since 2018, we have a National Center for Genetics at the LNS, which is indispensable for making a diagnosis in these genetic diseases. And we do have at the university, in other public research institutions, a rapidly developing biomedical research field. So given some of the weaknesses, but also these strengths, we believe that such a rare disease research center could have a profound impact on our patients and the healthcare system. It would be an ideal entry point for also promoting genomic medicine in our medical practices. We could here leverage existing strengths nationally to become also an important player in rare disease research internationally. We could synergize with large national digital health and personalized medicine programs like Clinova and a research and care program around Parkinson's disease, for example. Because of the genomic revolution and still the huge gap in knowledge that we have on these diseases, there remains a great discovery potential and also innovation potential in that field. So it's certainly, as for Fernand, it's fascinating to read his dossiers on Monday evening. For us, it's also still very fascinating to understand what's going on in these diseases. And we do have, last but not least, a unique funding opportunity in the country, because the André Losch Foundation has actually earmarked significant budget to kickstart such a research center, which would help, I think, to collect evidence to show that in making such investments, in the long run, it will actually save money and all the while improving our healthcare system. So our vision, it is not very complicated, is to develop a national center of excellence in rare disease research and care with the aim to improve the health and quality of life of children suffering from a rare disease and their families. Our mission is therefore to help children with rare disease in Luxembourg and have a meaningful impact on research and healthcare. I would like to underline it. So it will be research that is driven by clinical questions and medical needs. We will, in this center, perform research on personalized omics-based molecular diagnostic approaches and elucidating mechanisms underlying some of these rare diseases. And we will initially focus on inherited neurological, metabolic, and immune diseases. And this choice has been motivated by a number of reasons, one of them being that with those diseases as a group, I think we will address already a good part of a big fraction of the rare disease patients. And also, as was mentioned before, with, for example, metabolic diseases, if you diagnose them early, not always you can perfectly treat them, but you can certainly manage them better than diagnosing them too late. So the objectives will be to improve, accelerate this diagnosis, elucidate disease mechanisms, improve the medical care and management of the patients. In parallel to doing our research activities, we will build up a unique patient data and sample collection that will be a very precious resource to foster rare disease research here in the country and to connect to international projects. And as was also already mentioned, one important objective is to foster awareness, training and education, and will be one of the objectives of the Losch Centre as well, at all the levels of the population, going from the healthcare providers, the scientists, the medical students, and the patients themselves. So we have, as I said, strength and expertise in the country already, as you have seen at the Kana Clinic in the CHL, around diagnosis, care and clinical research, also in the LNS with the Center of Genetics around the same themes. At the University of Luxembourg, we are doing research on metabolic and neurological diseases, and we accumulate a big expertise in bioinformatics, computational sciences, especially on biomedical and medical data. At the Luxembourg Institute of Health, there is research on immune diseases, expertise on building patient cohorts and on biobanking, and of course with the very active patient association, ALAN, we have a long-standing experience and in patient education, awareness raising, and giving psychosocial support to families. And these 5 institutions are building the core of the research center. But we will, and we have to work with all the other hospitals in the country as well. And we do have partnerships with European research projects, with the European reference networks, and with the Patient Alliance Aurore 10. And these partnerships will be further strengthened through something like the Losch Centre.
Yeah. And with this center that we want to build up, we of course fully align with objectives that for rare diseases that are also put in the country, on both on the research side. If you look at the focus on personalized healthcare, of course, a rare disease patient is the best example for where you have to do personalized healthcare, because each and every patient is and family is individually. And of course, it's also a healthcare priority. You know this the best with the PNMR, but also in the new coalition agreement, rare diseases are put as a focus, and we are very happy about that. Not just on the national level, also on the international level, rare disease are a priority in research and in healthcare in Europe, and there are a lot of actions put in place in Europe and funding opportunities, and this aligns very well in what we want to do here in Luxembourg. What is very specific and very novel about this whole research and center is that we want to integrate the research directly into the healthcare pathway. This means that what we will do from the beginning will have direct impact on the patients, on the healthcare. So we want to include families and patients in a holistic care pathway together with the clinicians, in particular the pediatricians, but also with Alan, with the psychosocial workers, and we will then provide or want to provide diagnosis to these children by applying whole genome sequencing, a very modern technique that is ideal to identify the molecular cause. And if we do not identify the molecular cause, we will go further with applying other very modern methods, and if we find a diagnosis, we will directly give this back to the patient and the treating physician. So from the beginning, the patients will have a benefit from the program. But of course, this is not enough. That's what we said. To improve the treatment of the patient, we have to understand the mechanisms behind it, and this will be the follow-up research that we want to foster with this program. This whole goal we have put into a very structured research program that has several building blocks, including a genomic medicine program, molecular phenotyping program where we will follow up on the disease mechanism. As Carole already said, we want to set up a collection, a patient data collection, and we will have overarching themes. We will to make sure that our center is really integrated in a clinical care pathway. We have a clinical platform, and we will, all the data that we collect, we will put in a very sophisticated data management and analysis platform, and we will do an education and training program and do specific follow-up research projects. What we want to do and where we want to have funding for now is a first phase of 3 years in which we will build up the center, and in this first phase we want to enroll already 250 families that we want to provide hopefully with a diagnosis, and if this is successful, we aim to have overall funding for 10 years with a running phase where we will increase the take-up of families, but in this 10 years it will be crucial to build up a sustainable center with additional funding that we want to achieve. And what we really expect in the short and long term is that we have a profound impact on children and their families by better and faster diagnosing them, which will improve their management and quality of life. At the same time, this will have a direct impact on the healthcare system because patients will have access to genome sequencing. With the center, we want to really faster put research findings into the clinic, and it will of course help to train clinicians and physicians. It will have direct impact on science in Luxembourg because we will have a unique patient cohort for further research, and it will increase the collaboration between all the institutions that are already working very well together. At the same time, we will increase with this program awareness for rare diseases in the society, and by, and this was already said, if you earlier diagnose a patient, you can better management, and this at the end has also an economic impact. And what we also hope with such a center, that we can attract talents to Luxembourg. So this has really an important implication. We presented this to the FNR and the Andre Losch Foundation and to an international expert panel, and they were very impressed. They, at the end, and this was in October, unanimously recommended this center for funding. And I just want to highlight here some things. So they really acknowledge that this will be a game changer for rare disease patients in the country. And they are really also point out that our holistic approach to integrate this research into patient care together with clinicians, with the patient organization and with researchers is a really, really good example and really, really promising to change the situation. This center is led by, from each of the 5 institutions that we named, this is our leadership team, so Carole and I coordinating this, and we are really happy that that the CHL with Karine de Beaufort, who is very well active also in the PNMR, is leading it together with Daniel Tyson, the director of ALAN, and Manon Gantenbay from the Luxembourg Institute of Health. But of course, there were many people who worked together to bring this center into happening, and this is a picture of the people who were present at the presentation, at the panel presentation for this expert panel, and we were very happy because it went very well. And I want to thank all these people. Some of them are here in the room, but there were even much more behind it, plus the institutions who are supporting us all the way, and most importantly, the funders, the Losch Foundation and the FNR, with whom we're collaborating very well, and we are really hoping that we can launch this center this year. And with this, I thank you for your attention.